One of the earliest examples of a coronavirus cluster outside of the original cases in Wuhan, China, was the Diamond Princess cruise ship that was eventually allowed to dock at a port in Japan in February, where it was placed under quarantine for a month. It's what is called a hot zone. Some 700 passengers and crew were confirmed to have contracted the coronavirus, while 14 of them died. It's called a cluster because infections are linked to the same area, the same geographical area at the same time. In this instance, the ship. Major clusters were also reported in churches in South Korea, where thousands of cases were linked to one denomination, forcing the government to quickly order the screening of some 200,000 members while implementing rigorous inspections. In New York State, the governor ordered a containment area of 1.6 kilometers around the township of New Rochelle, which in early March accounted for 108 of the state's 173 cases.
New Rochelle is a particular problem. It is what they call a cluster. The numbers have been going up. The numbers continue to go up. The numbers are going up unabated. And we do need a special public health strategy for New Rochelle.
They identified it as a geographical hot zone, deployed the National Guard, immediately closed schools and facilities that would bring together large groups of people.
What we are going to do is focus on an area, concentric circle, around the situs of the majority of the cases in New Rochelle. Much of the transmission tends to happen on a geographic basis. Kids go to school, kids go to a store, parents go to a store, parents walk down the block, shake hands with someone, parent is walking the dog, meets somebody, says hello, has a conversation.
And with reopenings underway in Asia and Europe, an uptick in the number of cluster outbreaks is raising concern.
Over the weekend, we saw signs of the challenges that may lie ahead. In the Republic of Korea, bars and clubs were shut as a confirmed case led to many contacts being traced. In Wuhan, China, the first cluster of cases since their lockdown was lifted was identified. Germany has also reported an increase in cases since an easing of restrictions. Fortunately, all three countries have systems in place to detect and respond to a resurgence in cases.
Having those systems in place is key to identify infections, trace contacts that could develop into clusters, and in so doing, avoiding community transmission where the source of the origin is less clear. Sherwin Bryce-Pease, SABC News, New York.